What is the FRAX treatment threshold for osteoporosis? Imagine trying to predict who might break a bone in the next 10 years. That's where the FRAX tool comes in. It calculates the chance of fractures based on various risk factors. The goal is to identify people who could benefit from treatment before a fracture happens. The treatment threshold is set at specific risk levels. Usually, if your 10-year risk of a hip fracture is 3% or higher, or your risk of any major osteoporotic fracture is 20% or more, healthcare providers consider starting medication. These numbers are based on guidelines from different health authorities. For example, the United States National Osteoporosis Foundation recommends treatment if the hip fracture risk hits 3% or the major fracture risk reaches 20%. The United Kingdom's guidelines use an age-dependent approach, meaning the risk level that warrants treatment increases as you get older. For a younger person, the threshold might be around 5.5%, but for someone older, it could be over 11%. The FRAX assessment can be done with or without measuring bone density in the hip. When bone density data is available, it helps refine the risk estimate. If the risk is below these thresholds, lifestyle changes like diet and exercise are usually advised. If the risk is high, medications are often recommended to help strengthen bones and prevent fractures. Sometimes, if someone has already had a fracture, treatment might be started without needing to do a FRAX calculation because their risk is clearly high. Keep in mind that these thresholds are guidelines, and individual risk factors like fall risk or other health issues should also be considered. Always consult a healthcare professional for personalized advice. The goal is to catch those at high risk early and help prevent fractures before they happen, using the best available evidence and guidelines.